And I know one guy, for example, his main goal was that we're gonna take our 1-year-old to Disney in a couple of years. And I do not fit in any ride at all. My goal is that I can he said, my goal is that I can take my daughter on a ride. And that's his main goal. And this is him here. So in 9 weeks, he lost 70 pounds. And he's getting there. But he's not there yet. He can't fit in a ride yet. But his goal is that in a couple of years from now, he can make it there. And that's his one and only goal. Now granted, he's losing weight. His blood pressure is improving. I can imagine what his cholesterol is doing. I haven't been checking that. That's one of the things that we chose not to do. But his one goal is to fit in a ride. And he's going to be able to do it. Because it's all education. We're teaching them how to eat, how to shop properly first of all, then how to cook it properly, and then the proper portion sizes. So this new relationship with food is making all the difference for these ladies and a few males. But also the accountability that we have created within the group and how we hold each other accountable. It's a lot of Facebook messaging one another. And what we do is we create an individual Facebook group for each group. And I named them KDM Intense, Group 1, Group 2, Group 3, Group 4, but only the ones that are in the group can read the messages and share things, but we share stories, we share videos of somebody working out and saying, I just learned how to do the bear crawl, or I just did my first modified pull-up, and show videos of themselves doing this. We share a lot of recipes with one another. And then of course I can steal from one group and show them to the other as well. But it becomes such a close-knit group, which is so exciting to see that it's changing lives. And it's also, we're seeing these individuals come out of their shell too, where before they've been so timid and they've been embarrassed, and now they're in a group of more equals, but they're all growing together, but literally losing weight together. Many of them had different goals. So we had one lady I can think of in the first group. Her goal was just to be able to manage her diabetes better. Well, the first true excitement that I had in this program was when she came to one class, I think about 3 to 4 weeks into the program, made everybody stop what they were doing and said, guess what guys, I just cut my insulin in half. And it almost made me cry because, okay, I've never experienced that in the setting of in my office. I've never had that big of an impact that quickly, because truthfully, most people don't go home and just do exactly what you tell them. But in this group setting of holding people accountable, it really does work. Maybe it's part of it is my passion for it. This is how I am. I speak very passionately. Every Tuesday night, I go home and I won't stop talking about it because I'm so excited about changing these people's lives. But really, they feel the same way because they're approaching this hardcore. They are doing this. And now we're seeing that many of them can keep this up, not just in 9 weeks, but beyond. It was, though, a team approach, truly, because I could not have done this on my own without the support of our dietitian and the personal fitness trainer, and even the pharmacist that provided the blood pressure monitoring for home. Because we had a few patients that they were about to have a stroke. Their blood pressures were so high sometimes, I was really concerned. But then when they can show me their log from home, then I felt more reassured, and that's where the whole team approach really helps. Judy was in our first group, and she did great. Was one of the great success stories in the group, motivating, would be one of the ones sharing that, hey, I went to my family doc and guess what he's doing? He's excited, he's sharing the program now with other patients of his. And then I received a Facebook message from her, and where she said, guess what? He just took me off my last blood pressure medication. I've been on blood pressure medication for so long, I can't even remember, and then I've added more and more and more medication. And guess what we're doing now? We're taking them off and off and off. And just the money alone she's saving is well worth $149 investment long term. But
over 12
years.
years.
Yeah, exactly. And then over years and years, because she doesn't have to, again, no product, so she doesn't have to keep paying anybody. She now has the tools, they're up here. She knows what to do. So this has been so exciting, and I believe she lost 40 pounds and off of her blood pressure medication and even anxiety medications. It's exciting because now she has the tools and the knowledge to know what to do. And she's going to just keep sharing with her friends. And they always ask, okay, well, what's this diet you're on? And she's like, I'm not a diet. Okay, well, what medication are you on? I'm not on a medication. Okay, well, what's your shake? It's knowledge. Dr. Miller taught me, the dietitian taught me, and the personal fitness trainer taught me, this is how you should live your life. And they're all talking about, I have a new relationship with food, and they may not love exercise, but they do it because they know that's the way of life. So for Judy, within the 12 weeks, was able to get off of medication, or the other lady that cut her insulin in half. So that was immediate results. But one of the ladies that took the class, she was thinking about having a hysterectomy. And anesthesia requires us to do a certain pre-op workup if they have a certain amount of weight, if they have medical comorbidities. Well, we have just been able to remove her from where she would have needed not only blood work but an EKG and whatnot, to now she won't need all of that workup because she is much better. She's at a different BMI and she's much healthier and off of her medications. So it has long-term effects. The fact that we've decreased their risk of diabetes in the future if they were not already diabetics. The cholesterol, not needing cholesterol medications at least maybe for the next decade. The cost savings are immense if you multiply it by years and not just thinking of 2018.
So that comes out to be 65% of your patients saw a decrease in systolic, 62% diastolic, and then 92% of patients saw a decrease in weight. With, interestingly, 100% of your patients had an improvement in PHQ-9. What does this data tell you in terms of moving forward?
It's so exciting, right? And starting with the last one, the 100%, that was one of those things I just decided to throw in before we started the program. Let's check and see, because I bet a lot of them are going to be depressed. I didn't think 100% of them were going to be depressed. But I also had no clue that we were going to affect patients like this. All of them, 100% of them felt so much better. And 6 points on that scale is very impressive because many went from maybe 8 all the way down to 2, which is basically minimal or hardly any depression at all.
Right.
That was the most surprisingly and very exciting finding for me. I knew that we were going to have a great decrease in the weight only because I named the program Intense, KDM being my initials. I named it KDM Intense because it is really a hard program. I mean, you've got to be committed. And I tell patients when I advise them in the office in that counseling session, don't join the program if you're not ready to change your life, because this will change your life. You will never be the same again because you will now have the knowledge of what you need to do to eat right. So I suspected that we were going to have a great weight loss. I didn't think 92%, but I suspected that greater than 50% we were going to be able to reach that. I also didn't suspect that over 60% we were going to see that much of blood pressure improvement. I mean, 6 points in the diastolic on average is pretty phenomenal. Now, mind you, this is just a pilot study. I'm hoping next year, if you ask me again, that now we'll have maybe an N instead of in the teens to 20s, we have an N of 100 or more. And now we can truly say, yes, we're making a big impact in our county.
So just in closing, this started out as a pilot, this idea, this kind of dream of yours that just hadn't made its way to reality. And now that the pilot's over and you're moving forward with just this program in your practice, how do you see that working sustainably?
There's a big buzzword in medicine, and that's called physician burnout. And not that I was to the point of burnout, but delivering babies is so much fun, but if you do it for so many nights in a row, it gets really hard. I needed something to make me feel like I was making an impact in people's lives that was beyond just being there for arguably the most important part of their life, being the birth of their child. But I wanted to make a medical improvement somehow in their lives. And this, I found, was what I needed. So personally, I'm getting so much joy out of this. Now granted, we live in a small town, Kansas, so guess what? I run into these people all the time outside of the office. And so it's helpful to run into somebody, or you might high-five them and say, hey, you're changing my life, you know that, right? And yeah, because I get to hear that all the time now.
And they're changing your life.
Exactly. And yeah, so it's not just for the benefit of them. I'm actually personally benefiting as a physician, but also my personal life. Plus, I'm actually the best weight I've been since I'm back to my pre-pregnancy weight myself, because I'm not participating in terms of, I'm not counting my calories, I'm not using the menus myself, but guess what? Portion control, I preach it, and guess what I think about every time I put something on my plate? I think now portion control, and I'd rather go for seconds rather than taking too much the first time. And so I'm trying to practice what I preach, and it's working even for me.
Well, that's an amazingly motivating story, I think, both for physicians and for patients, so thank you.
Okay.